trailblazer. She's a voice for her generation. She's a leader. And I'm very glad that I know her. I'm very proud to be associated with her. My name is Dr. Ezinne Nwude. I am a medical doctor at the Medical Center of South Arkansas, our only hospital here in town. My husband is the owner of Gold Cross Urgent Care. Thank you, Diane. And he's also the owner of the Gold Cross Family Clinic in Junction City. We are blessed to be in El Dorado, Arkansas. We are so blessed that we've been accepted with open arms. I thank God for ordering our footsteps to be here. Everyone asks, how does a Nigerian girl end up in El Dorado? And I say it's only by divine intervention. And I will not change it 1 bit. If there is reincarnation, my grandmother believes there's reincarnation, I will come back to El Dorado. All right, today, as a physician, as a medical doctor, I like to start by the definition of health. What is health? Health is a state of physical, mental, and social well-being. Health, as we know it, is not just your physical well-being. When you have diabetes or when you have high blood pressure, health, people, listen to me. For you to say that you're healthy, it means truly that you have good physical, good mental, and good social well-being. They are all interconnected. There is absolutely no way that you can have depression, whether it be what we call acute, very new, very recent, in the moment, current feelings of depression for something that has just happened, but the feeling will be short-lived and you move on, or what we'll call clinical or chronic depression. This feeling is going on for a month, 2 months, 3 months. It's not getting better. But you don't take medicine for diabetes because your blood sugar is good. You don't take medicine for high blood pressure because your blood sugar is good. You don't take medicines for high cholesterol because your cholesterol is good. And you tell me you're healthy. As a physician, I'll tell you you're not healthy. If your mind is good and you're in a good state where you're not depressed, where you're not anxious, physiologically, blood pressure perfect, blood sugar perfect, cholesterol level perfect, thyroid perfect, but you don't talk to your mother. You are in a heated hatred with your sisters, your brothers. You can't go to this person's house because I hate her so much. I hate him so much. Your social circle is dead. It's unhealthy.
Yeah.
You are not healthy. Again, for you to boldly tell a physician like Dr. Nwude that you're healthy, that means that you're bold enough to tell me that you have a good physical, a good mental, and a good social well-being. So I hope you remember that today.
Yeah.
I was a medical student. I was a first-year resident. When I was at the wedding, hanging out with other doctors in training, resident doctors, when you finish your medical school, then you go on to residency training. We're up in Fairview, PJ. And I went out of town to this wedding, and I am a family medicine doctor, so I was in my family medicine residency, and this other girl, she was a white girl, she was in her psychiatry residency. Out of curiosity, I said to her, when you're a night caller, they call, like, who do you usually see that come to the ER? Are they like white girls, black girls, Hispanic girls? She was in upstate New York, a small town just like El Dorado, Arkansas. She looks at me and she smiles and she says, I see them all. In the black community, whether you're African American or you're African, whether you live in El Dorado, Arkansas, or you live in Umuahia, Abia State, Nigeria, we stigmatize mental health. We need to stop. Every one of us in this room today, we can be a voice to stand up for mental health. If your sister is depressed, she's not healthy. Please, there is no reason to stigmatize something so important, something that can stop you from moving on. As a physician, I am aware that in our community there is a big distrust for healthcare practitioners. There's a lot of fear because most times this is people you see, they don't look like you. It was in recent years that you had a Dr. Nwude that looked like you, even though her last name might not be like your last name. But at least before you know what her name is, you can see that she looks like you and you can be more open to her. But I want to encourage you today to be the voice that he talked about. You must stand up for yourself. You have the right to demand treatment. If you're going to a physician in a clinic, or you're going to the emergency room, or you're in the hospital, and you feel for whatever reason you're not getting the treatment that you deserve, please speak up. When someone who's doing something wrong gets challenged, trust me, they stop. I know. There is no reason why you would not go to your doctor and you stay at home and die in silence. Whether it be your physical health, please, I'm begging you today. Go to the clinic. Go. Speak for yourself. You are your own voice. There is only one life, and there is no photocopy. Whatever you do, fight like crazy to stay alive.